Hello, everybody. Welcome to TPC Leadership sponsored WOWtalks once again. And today we are featuring a women leader who is a HOD of Ophthalmology in Max Hospital, Delhi, Gurgaon. She's joining us from Bangalore, balancing work and life. And I can imagine she took time out for us for this WOWtalk, the Wings of Women talks, as we call it. And I'm also joined by my media consultant, Preeti, who she has been covering global business summits, and she has been a media consultant for many celebrities and entrepreneurs across India. So let me just begin by introducing and asking Dr. Parul Sharma, what has kept you going, Dr. Parul? You know, you have 23 years of experience. You started off as an intern in healthcare, and now looking at your amazing success, what has been the mantra behind your success?
So, success, look at success right now, and what we are talking in context right now is from the professional front starting. And I think almost everybody, when they start a career, you always start from the first step on the ladder. And then you reach somewhere mid-segment, trying to go up. So that's a journey of almost every women in any kind of work profession. And for us, more so for healthcare people, there is no shortcut. There's a grueling couple of years of studies, almost a decade, and then you go for fellowships, and then you have to train yourself. India doesn't provide you any kind of blanket support once you come out with degree. It's such a huge professional shock that you have to literally start from scratch all over again. You walk out wearing a white apron, having your skills and your degrees, and you just have to start from raw bottom, where you're probably standing in one side of a clinic. Nobody's even looking at you when you're a junior consultant or an intern. So it's all about training yourself, having the right attitude. It's about having that vision in front of you, both for yourself, because somehow in work, we kind of intermittently lose focus on where we are in this whole game field professionally. So it's very important right from the beginning to have an attitude and have a perspective and a balance on what are your professional goals, what you are as a person, your limitations, your strengths, your skills, and, keep improvising on them. So more than skill, most people in our job, we have to be skilled. It's a given. We are trained for 12 years nonstop to be skilled. So that's a given. Even then, when you come out professionally, you have, mediocre doctors, mediocre surgeons, and you have excellent surgeons and excellent doctors. So where is the gap? Where is the bridge? What is different about these two different categories, and which is there in almost all professions, right?
Yeah.
For me, skill is a given. For me, the most important thing is attitude. Even in my hiring, I look at people's attitude towards work, attitude towards themselves, attitude towards life. That is what keeps going. So your confidence, your hard work, your charisma, your leadership quality, everything, if you look at it, depends on your attitude. So I would put that as number one, as my strength. Also, I'm a survival because I lost my, father very early in life. And when I got married, also, there was no, senior person here. So I had a lot of responsibility. So that primal instinct of survival, when you have less, it's much easier and it's much more organic for you to, work hard and want more. So the attitude towards life, the attitude again towards profession, and of course, your colleagues along the way. If you've had your own journey in a certain way, it just makes you more empathetic with, the way we've been. Because 25 years back, there was no training, there was no corporate, there was no HR, there was no listening. You may be pregnant. I had no maternity leave. I have worked till the last day of my pregnancy, operated in morning, delivered at night. I was ad hoc in a government job working for a pregnant lady. So I couldn't, take leave, and I was back to work in 12 days. But it's the attitude. Am I bitter about it? No. I mean, I take a lot of pride in coming back to work and breastfeeding my daughter throughout that 1 year. I used to make trips from hospital to home, and she didn't miss a single breastfeed during that time. I haven't enjoyed any maternity leave. Did that make my daughter any different? No. So it's all about that attitude, what you carry and what you believe in. It just naturally and organically transmits to people around you. So I would
So
say
true.
attitude, skill is a given, as I said, and the ability to say yes. Because in life, many a times, all the opportunities, both hidden and the obvious, there'll always be opportunities for you every single day when you step out. Some people naturally are more tuned to saying yes, bring it on, and some people are very cautious and they have a more no approach, and they'll be thinking a lot about it. No harm in both the approaches, but for me personally, the capability to say yes to most of the things which come along my way on my plate probably has been my strength, and probably has led me so far, because I didn't have a godfather. There's not a single medical person in my family. Delhi was a completely new city to me. At that time, 25 years back in healthcare, not so welcoming, but yeah, you made your way probably with these strengths and attributes.
Awesome.
Well, Dr. Parul, tell me something. You are primarily, you're an eye surgeon. So
Yeah.
how did the COVID era impact you? It may have not impacted your work environment directly, but how was the pre-COVID time for you versus now that we are sitting in the not post-COVID? I would say we're still in the middle of the pandemic, but things have they eased out? How was it? How has been this 1 year journey for you?
See, interestingly, it was very hard for doctors, except the doctors who were posted in COVID duties and who were, who would manage on video calling. The on-site jobs were difficult, especially people like our profession where we had to come very close to the patient. So ophthalmology, dental, ENT, where you had to be very close to the patients, was very tricky. A lot of elective surgeries and elective procedures had to wait. So it was a mix. Some people were very busy, and again, it became taxing for them, the doctors, in COVID times. And some had literally no work. So imagine you're operating, seeing patients every day, and that's your feeder. That's what feeds your soul every day. And that nutrition gets taken away from you, because in a way, doctors are also a bit selfish. When we are seeing patients and doing good for them, it's a lot of soul nourishing happening for yourselves. So a lot of doctors were also stuck at home just doing video consults, and it was a difficult time at that front. Managing your patients who cannot come for follow-ups, plus not being, on physical contact with one-to-one. So it was really tough for doctors. We don't have a platform to share. We are not corporates. We don't have HRs. I mean, they do reach out, but it's not like a one-to-one. So I know a lot of junior doctors and senior doctors who've gone through a tough time last year. But then, medicine makes you more resilient, and you take each day as it comes, because you see life and death so closely. That you know how to filter things in your mind. It also gives people time to introspect. So some people who were very busy surgeons and very busy doctors got time to, be with their families, pause for a bit, see whether it was worth really working 18 hours a day. And people who were out of work in this time also found new means to keep themselves busy, to find other joys of life which they could never ever do, like all of you. I'm sure everybody baked and gardened and danced and spent time with their families, quality time. So I think it was a very enriching time for everybody to introspect. For me myself, I mean, I've been working non-stop for 23 years. In my career, I can say probably I've not had a day's break also, because I always planned my next job before I left this one. So for me, it was an instant stop for a bit, and I used to volunteer myself for COVID duties just because I didn't know what to do with myself if not work. So, so read a lot, did other things which were my passion. I did Kathak online throughout the COVID, not missed a single class, probably 4 evenings throughout the Kathak I was doing. Throughout the COVID, I was doing my Kathak, and now, it's become my second life. I sometimes run from my OPDs away because I want to do my Kathak. So a lot of introspection, a lot of slowing down, a lot of trying to, look at quality, how you can improvise things. I think that's every day for as many years. For 17, 18 years, I've been with Max Healthcare, and I used to work half day Delhi, half day Gurgaon. Henceforth, I decided that I'm going to spend more time in Gurgaon, cut down my Delhi visits, so...
Dr. Parul, do you think that somewhere you do not believe in work-life balance, or do you believe in work-life balance?
Oh, 101%. See, we don't
you
have
said
a
you
choice.
worked for 23 years non-stop. Yeah. That's too much of work.
But I've done a lot of other things in these 23 years despite work. I'm a youth social cause supporter. So you'll find me everywhere, be it women's safety, be it pollution campaigns, be it any kind of social cause campaign. Probably I'm the one to start it. So Not in My Name was started, that Not in My Name Gurgaon chapter I started thinking, just a thought in my head. I do a lot of social camps. I've been to Afghanistan, I've been to Iraq, Karbala. My daughter is a Bharatnatyam dancer for 13 years,
Wow.
and she's a fine girl. So I'm sure I'm doing something right back at home. My husband is happy with the whole situation. So I'm a strong believer in work-life balance. Truly, we don't get a choice. And in India, in any other profession, in the first probably 5-10 years, you don't have that luxury of making such a great choice. But as you come in mid-leadership position and as you have some strength and you have some say, you do start looking at the work-life balance. And on speaking on work-life balance, I always tell my colleagues and my juniors that, the key for a good work-life balance is not just being a manager at work, but being a good manager at home. So at my home, most of the things are outsourced. So my domestic help is not called a domestic help. She's the manager of my house. So she writes, she maintains a diary. The driver will serve as a multi-purpose guy. So, for working women, the work-life balance only comes when we let go. As at our workplace also, we assign responsibilities and then not be probably so micro about things. So I may not know where all my dal, rice dabbas are, which of course I know after the COVID phase. But as long as a nice fresh meal, warm meal is coming on table for the family, it's good enough, right? So everybody needs to create that work-life balance. Initially, for a few years, as I said, you may not have the luxury because you're really working hard for the longest. But then gradually you learn how to do that.
And what will be
so wish, Preeti, this goes to as many women as possible who are going to watch.
Absolutely.
Let's spread it far and beyond. And what I have picked up so far from Dr. Parul Sharma's talk is soar high. One can soar high if skills is guaranteed, skill is taken. Opportunities is something that you need to create for yourself. Attitude is the biggest thing that she's talking about. And I would like to add an R. I think she has a lot of resilience in herself that has brought her to this level. And that's how I would call it. A woman can soar high if she has all these, right?
As the home manager, the manager who is, taking care of all the things and maintaining a diary. I'm hearing it for the first time. That's very interesting.
Yeah.
Awesome.
What is that one advice you would like to give the women out there who are watching you and, who want to be like you and, you inspire them?
So for women in leadership, I would say don't give any advice. Ask more questions. Asking more questions leads to more open conversations, and open communication brings more things on table. You get to understand the other people more. You will know more about your team members. You will know what their strengths are, what their blocks are. My advice to the bestest person sitting across the table may not work, because my advice is my take on life, my perspective. The other person's perspective on life would be very different depending on his life journey. So my only advice to women leaders is do not advise, ask more questions and have more talking time with your team.
Awesome.
Yes.
Awesome. That resonates so well with me, Dr. Parul. I am a coach trainer and a coach myself. So yes,
she's been asking questions for a very long time now.
No, but it really resonates with me, what you just said. I think that's the message every leader must hear. This is the one advice I would like every leader to hear. So thank you so much once again for volunteering to have this WOW talk. This was really one last thing that's emerging for me, that she's not the doctor for just offering you the sight, but I think she has a lot of insight that she can offer. So,
that's a good one. I will use it on next platform.
Please do. You truly do bring in a lot of insights with you. Thank you so much.
Yeah.